thank you for joining this presentation. I'm going to talk to you today about conceptualizing well-being for migrant and seasonal farm workers in a systematic literature review that our team conducted to inform this effort. My name is Tessa Bonney, and I am the presenting author for this. I do want to acknowledge my co-authors and other contributors to this project. I also want to note that we have no conflicts of interest to disclose and that this work was supported by NIOSH, and the views expressed in this material are not necessarily the views of the Department of Health and Human Services, CDC, or NIOSH. So to start out with a bit of background about the concept of well-being. Well-being is broadly conceptualized as a positive state of being absent of negative factors. And this concept is studied across fields: psychology, sociology, economics, public health, many other fields. And it's increasingly considered a major health outcome. Various definitions, depending on the lens, exist, and the operationalization of each definition for research and practice has important ramifications for how we understand well-being in different subsets of the population, and long-term has implications for the interventions that can be developed and implemented to improve well-being. In recent years, a multidisciplinary team of researchers, including representatives from NIOSH and from the RAND Corporation, have worked together to develop a conceptual framework for worker well-being. And the development of the proposed framework involved a comprehensive review of relevant work and well-being literature, along with input from researchers with expertise in well-being and in occupational health and safety. And ultimately, the conceptualization of worker well-being included 5 domains: workplace physical environment and safety climate, workplace policies and cultures, health status, work evaluation and experience, and home, community, and society. And a subset of the initial multidisciplinary team and several additional occupational health researchers worked together to then operationalize this framework, which ultimately resulted in the publication of the NIOSH Worker Wellbeing Questionnaire, or the NIOSH WellBeQ. With the emergence of this conceptualization of worker well-being comes the question of whether its components are well aligned with what is known about well-being and its determinants in workforces with fundamentally different characteristics. In particular, is this conceptualization of worker well-being aligned with what is known about well-being and its determinants in precariously employed workforces? And we sought to explore this question specifically in the context of what is known about well-being and its determinants in migrant and seasonal farm workers in the United States. And I just want to note that this effort was undertaken in the context of a larger study within a larger NIOSH-funded Center for Agricultural Safety and Health at the University of Illinois, Chicago. And our study is explicitly focused on understanding farm worker health and well-being. Our research project housed within this center aims to measure farm worker well-being. And at the outset of the project, we reviewed the NIOSH well-being domains and conducted a farm worker-focused literature review, which is what I'm presenting here. And our ultimate goal is to adapt, translate, and test our well-being questionnaire made up of existing items from sources such as the NIOSH WellBeQ and newly developed items in a sample of migrant and seasonal farm workers in Illinois. So the goals of our systematic literature review were to examine literature aligned with the NIOSH worker well-being domains and subdomains, but specifically focused on migrant and seasonal farm worker populations in the U.S. We also sought to describe the alignment and misalignment of constructs identified in the literature that we found with the NIOSH worker well-being conceptualization. And we also sought to describe any new constructs that emerged from this literature that are not well described in the NIOSH worker well-being conceptualization. So our first step involved the refinement of our search terms to ensure that we were gathering studies that honed in on our population of interest and that captured elements included in the NIOSH worker well-being conceptualization. So notably, the NIOSH conceptualization is based on well-being literature broadly and not specific to a single occupation. So we thus included a comprehensive list of terms to capture specifically migrant and seasonal farm workers in our search. Our worker well-being search terms on the right included the domains and subdomains from the NIOSH model. So here's a table that was published alongside the NIOSH Worker Wellbeing Questionnaire, which illustrates the domains and subdomains of the framework, which were used as our search terms for our literature review. We searched 4 well-established databases that we thought aligned well with our search goals. Our search population terms, we searched in titles and abstracts only. We only included search results with available abstracts. We only looked at English language results, and we only showed peer-reviewed articles. Now, we excluded dissertations, and we excluded studies that were explicitly focused on children, youth, adolescents, and intervention studies from our search. We used the Covidence platform to house and screen all titles and abstracts identified through our search. And in our screening phase, we expanded our exclusion criteria based on an initial skim of titles and abstracts. So with such a broad search, we captured many articles that we deemed not appropriate for our purposes, and we sought to screen them out at this stage. We excluded non-US studies, given our focus on the employment context specific to the US. We also excluded studies that focused on groups that worked with farm workers, but that weren't farm workers themselves. So for example, nurses or community health workers. And then one notable exclusion that we made at this stage was to exclude articles that focused on pesticide exposures. We excluded these because there were so many, and we wanted to more broadly understand the literature aligned with the NIOSH worker well-being domains. However, we do recognize that these studies are relevant to the health and well-being of this population. And we want to note that there are many published reviews and analyses of these studies. So this is a notable exclusion that we made for feasibility. And ultimately, we reviewed 268 full text articles. Upon our full text review of the articles that we identified to be relevant to our search, we found many studies with focal variables that aligned with the NIOSH worker well-being domain of workplace physical environment and safety climate. And this was not surprising to us given the hazardous nature of farm work and the breadth of occupational health and safety studies in this area. Notably, in addition to the hazards in the physical environment of the workplace, the final subdomain of the NIOSH domain, the interpersonal conflict and incivility, aligned with studies that we identified that focused on things like discrimination, harassment, and bullying in this population. And these are pervasive issues for migrant and seasonal farm workers. The domain that appeared least aligned with the literature that we identified was the work evaluation and experience domain. There's a dearth of studies focused on these elements of farm work, and this could be because other elements of farm work are recognized to be so pervasive and acutely hazardous that these other elements are not always prioritized for study. We also found that there were various elements studied in the migrant and seasonal farm worker focused literature that did not neatly align with the NIOSH worker well-being domains. The precariousness of work was a common thread through the studies that we reviewed and was not well described in any existing domain or subdomain. Issues such as housing, food insecurity, or quality came up frequently and were highly correlated with work arrangements and employment quality. And other elements that we found repeatedly were related to healthcare, exposures specific to farm work, and more nuanced health outcomes that are included in the NIOSH framework. From our findings, we identified some preliminary ways that the conceptualization of worker well-being might be adapted or expanded for migrant and seasonal farm workers and for other precariously employed workforces. So the addition of a robust social determinants domain is warranted, we feel, for this workforce, given that it is often impossible to disentangle issues around meeting basic needs from work. In other less precarious workforces, meeting basic needs may be assumed. However, this is not the case in this workforce, where employers are often the providers or the brokers of housing, food, and clothing access. The addition of occupational specific exposures and work histories to understand prior exposures may be useful, as there are many unique health outcomes in workforces like this one that impact well-being. And finally, work precarity is not explicitly included, though research demonstrates precarity as a predictor of adverse physical and mental health, and this could really be a value add. Our approach is subject to some notable limitations. So first, we limited our search terms to focus on NIOSH's worker well-being conceptualization, and thus we may have missed out on some informative studies with differing terms. We also excluded potentially relevant studies, such as those focused on pesticide exposures, and we focused on largely health-focused databases, which may have limited our search. Despite these limitations, our effort was useful in informing the utility of using the NIOSH worker well-being conceptualization to understand well-being in migrant and seasonal farm workers. And it also helped us to identify potential areas of expansion for worker well-being conceptualizations for this and other precariously employed workforces. Thank you so much for viewing our presentation. Here's our contact information should you wish to reach out to us. And I look forward to the Q&A session in a couple of weeks.